صباح الخير. النهاردة المحاضرة الثانية Epidemiology of Periodontal Diseases. هنتكلم فيها عن ال Periodontal Index, Community Periodontal Index of Treatment Need, and some of the assessment cases. Indices for the assessment of the periodontal disease. They are either irreversible index or composite أو اللي احنا قلنا عليها complex indices. احنا هناخد اتنين من ال complex indices. Start with what's called a Russell Periodontal Index. It is a composite index وده معناه إن هو it records reversible and irreversible condition. The purpose it's used to assess and measure periodontal disease status in a population for epidemiological studies or even for the clinical trial. It measures gingival inflammation, pocket formation, and masticatory function. Russell السنان اللي قال عليها أقدر أكشف عليها هي all the teeth. However, في حد author تاني عمل modification واستخدم partial recording system عبارة عن إن أنا أستخدم ال upper left central and 4 right 7 and the reverse in the lower. إيه الكرايتيريا اللي بيستخدمها for the assessment؟ الكرايتيريا running on scales. السكيل ده مختلف عن السكيلز الأخرى. starting by 0 يبقى أنا ما عنديش لا gingival inflammation ولا عندي أي periodontal problems. 1 mild gingivitis عندنا inflammation but not circumscribe the tooth، يعني مش محوط السنة كلها الانفلاميشن الجنجيفال انفلاميشن مش محوط كل السنة، محوط one surface or two surfaces. نخلي بالنا من كلمة but دي لأن أنا ألاقيها بتتكرر في كل سكور. سكور 2 الانفلاميشن بقى circumscribing the tooth محوط السنة كلها، but تاني مفيش break of the epithelial attachment. يبقى لغاية دلوقتي score 1 and 2 record reversible condition either mild gingivitis or a gingivitis. المفروض يبقى في score 3 لا جه 6. في pocket formation يعني في attachment loss but without loss of the masticatory function. في pocket لكن السنة firm in its place أقدر استخدمها في masticatory function. It is not loose or drifted. 8 there is an advanced destruction with loss of the masticatory function. يبقى هنا عندي السكور 1 0 1 2 بدل 3 و4 بقى 6 و8. هنعرف ليه. هعمل scoring as usual. The periodontal index of the individual هيبقى ال periodontal index scores for all teeth examined divided by the number of the teeth of a group means the sum of the periodontal indices score for all individual divided by their number. ليه بقى الأوثر write 6 after 2 في السكورينج بتاعه وما استخدمش السكورز الإجابة to avoid misinterpretation when calculating arithmetic mean. لما أجي أحسب المين ما يدينيش misleading interpretation. معناها إيه الكلام ده؟ هنطبق على example. let us إن أنا استخدمت the partial recording system باستخدام 6 أسنان معينة هي اللي هكشف عليها. طيب لو أنا استخدمت السكيل العادي اللي هو المفروض 0 1 2 3 4 هستخدم ده وشوف الكلام ده صحيح ولا لا. Upon examination on this patient أنا لقيت ال upper left 4 أخد سكور 2. يعني إيه سكور 2؟ يعني عنده gingival inflammation circumscribing the tooth. الupper left central أخدت 0. الupper right 7 أخد سكور 3. سكور 3 يعني فيها attachment loss without loss of function. And so on for all. نحسب المين بقى؟ 2 و0 3 و1 و0 و4 يبقى 10. على number of the teeth examined اللي هم 6 اداني سكور 1.67%. طيب نجرب السكور بتاعة راسل لنفس البيشنت. 2 هتفضل زي ما هي 2، 0 هو 0، لكن سكور 3 بقى 6، 1 هو 1، 0، سكور 4 بقى 8 بالسكيل بتاع راسل. نحسب المين of this patient بقى 2 و0 6 1 0 8 يعني 17. على number of the teeth examined اللي هي 6 ادتني 2.83%. ايه بقى الفرق؟ الفرق هنا ان الريدنج يقع ما بين 1 و2، يعني اقدر اقول ان البيشنت ده عنده gingivitis which is not true. ده هو عنده أسنان فيها periodontitis وفيها أسنان فيها advanced كمان loss of the masticatory function. بينما هنا الريتنج وقع ما بين 2 و6 which mean in this patient have gingival inflammation in some teeth and periodontal affection in the other teeth. وبالتالي this is wrong interpretation and this is correct interpretation. يبقى كلامه صح، هو وسع الجاب ما بين الجنجيفايتس and periodontitis عشان تديني correct interpretation of the mean. Therefore, why the author writes 6 after 2? To avoid misinterpretation when calculating the arithmetic mean and have a clear-cut rating of gingivitis and periodontitis. يبقى أنا لو السكيلز واقعة أو الريدنج اللي طلع لي واقع ما بين 1 و 2 it's a case of gingivitis. All the teeth have a gingivitis. لو كان ما بين الاتنين والستة يبقى في عندي جزء gingivitis وجزء periodontitis. إذا طلع الرقم أكتر من 6 يبقى all the teeth have a periodontitis. أسوان. The Nile River in Aswan. We have a chart, a case, to apply this previously. 6 teeth were used to assess the periodontal health in 35-year-old patient. Upon examination, the following was recorded. One tooth had gingival inflammation at all surfaces. يبقى تاخد سكور كام؟ 2 صح. Another one had a pocket of a depth 4 mm. يبقى في attachment loss. لكن ال 4 mm never يبقى فيها loss of the masticatory function. هتاخد سكور 6. One had also gingival inflammation at its lingual surface بس. يبقى this is not circumscribe the tooth. Score 1. One other tooth showed gingival recession, excessive mobility. This means loss of function. It takes a score 8, yes. And the remaining 2 teeth showed mild degree of gingival inflammation at the labial surface only. This means an inflammation not circumscribing the tooth takes score 1. The questions identify these teeth. He told us 6 teeth were recorded. This means you have to report the index teeth, the partial recording system, and calculate the periodontal index for this patient. حطينا السكورز بتاعة الأسنان. يبقى إذن the teeth are the index teeth selected by Lilienthal. the scores, I will write all the scores. Then calculate the index. 2 plus 6 plus 1 plus 8 plus 1 plus 1. The total is 19 divided by 6, the number of the teeth examined. The outcomes 3.17. This means it lies between 2 and 6. These patients have a gingivitis and periodontitis. The second index, Community Periodontal Index of Treatment Need. This is the only index which refers to the treatment need. The purpose to screen, monitor periodontal treatment need of individual, whether in epidemiological studies or in clinical trials. The advantage, it is simple and practical, objective in its criterion methodology, identify prevalence and severity of the periodontal disease with respect of the treatment need. It facilitates planning of an appropriate oral health care for individuals and population. Indicators هو إيه اللي أنا هكشف عليه بقى؟ Presence or absence of gingival bleeding on gentle probing as indication of the gingival inflammation. Presence or absence of supragingival or subgingival calculus or other retentive factor as an etiologic factor for periodontal disease. Presence or absence of periodontal bucket, whether shallow or deep bucket, as an evidence of periodontitis. Therefore, it assesses both reversible and irreversible condition. It is a composite index or it is a complex index. The same names are alternative. Teeth selection. Which teeth we will apply this index? We have a two types. For epidemiological studies, we use index teeth. We use a specific teeth. In a clinical trial, we use the sextant. Sextant means I will examine all the oral cavity. And I will record in what's called an index chart. 6 teeth only will be recorded. 6 teeth only will be recorded. Sextant, as we told before in the oral hygiene index simplified, I will divide the mouth into 6 segments. It's called sextant. Sixths of dentition. 3 for the upper and 3 for the lower. Upper anterior, right posterior, left posteriors, and the same for the lower. I will examine all, but I will record the worst in each quadrant. The quadrant considered to be present if it contains at least 2 functional teeth qualifying for recording. يعني إيه functional teeth؟ يعني بيستخدمهم في الماstication. They are not loose. They are not drifted. Again, I examine all the teeth, divided the mouth into 6 segments or sixes. First, the anterior segment starting from canine to canine. The posterior segment either for the right or the left, starting from the first premolars to the second molar. Then I'll examine all the teeth and record the worst. Suppose the 7 had the highest score here and takes 2. I will record 2. Here the canine takes the worst score. 3. I record score 3 here. And so on. Another chart. The upper right quadrant contains only one functional tooth, which is 6. This quadrant is one tooth only, is not qualifying for recording. In this case, I will draw a diagonal line. This diagonal line indicating that this quadrant doesn't contain at least 2 functional teeth qualifying for recording. And the 6 is added to the adjacent quadrant and it will be examined in this quadrant and record. Even the 6 had the highest score, this score will be recorded for the anterior quadrant. A sextant also, but the upper right containing 6 only. Remove 6, put a diagonal line, add 6 to the anterior quadrant, and then examine all and record. If 6 have the worst score, it will record it. Index teeth used for epidemiological studies اللي أنا عندي فيها large number of people which is difficult to examine all the mouths. They will be divided 20 years or more or less than 1 year. 20 years or more, we have index teeth similar to that of the oral hygiene index simplified, but we add 7 in every one quadrant. Below the age of 20, we remove the 7. The same teeth for the oral hygiene index simplified. Again, the index teeth. If the patient 20 years or more, they are 10 teeth. If the patient less than 20 years, the same teeth as the oral hygiene index simplified. ده متحف النوبة في أسوان، من المتاحف الجميلة جدا اللي ممكن نزورها. Now we have a questions. Question number 1. Patient more than 20 years, we examine 10 years, but the index chart we have to record only 6. The second question, why 7 excluded in the patient less than 20 years? The third, أعمل إيه لو ما كانش عندي index tooth in this quadrant or index teeth in this quadrant? First, إحنا عندنا rules إن لازم تبقى في سنة ممثلة لكل quadrant. يبقى أنا دلوقتي عندي 10 سنين already، بس عندي في posterior quadrant 2 molars. يبقى أنا I will record the central for the anterior quadrant upper or lower, but I will examine 6 and 7 and record the worst. يبقى for the posterior quadrant, the 2 teeth will be examined and the worst only is recorded. Why we exclude 7 in a patient below than 20 years? To avoid misinterpretation of the deepened gingival crevices usually associated with the tooth eruption as inflammatory bucket. ال7 بيطلع في الايدجز ده، مش في ايدج 20 ماشي it's okay، في الخمستاشرات 12 13 15 ممكن يتأخر. دايما بيبقى في عندي some sort of gingival inflammation associated with the eruption، فده ممكن يعمل لي pseudo bucket والناس تعمل لها wrong interpretation as a pathological bucket. To avoid this misinterpretation, 7 is excluded and I have to examine only the index teeth, the central and the first permanent molar. اوكي انا عندي index teeth محددة، افرض السنترال دي مش موجودة في الانتيريور segment، اتصرف ازاي؟ I have to examine all the remaining tooth or the remaining teeth in this quadrant and record the worst. If no index teeth is present in any of the quadrants, all the remaining teeth should be examined and record the worst. How can I conduct such examination? This CPITN index have a specific probe called CPITN probe. ليه specific characteristics. This probe is very light, has a pull end of about 0.5 millimeter in diameter, have a plaque mark between 3.5 millimeter and 5.5 millimeter. ليه designed by this way. The examination with the CPITN probe is a sensing instrument. It is a very light in weight, easy to explore bleeding response with this round ball without any over instrumentation, easy to detect calculus or any defective margin. It could determine the bucket depth so easy and determine if it is shallow bucket or a deep bucket. We will see now. When you examine or to detect the bucket depth, it should be explored on at least 6 points: mesiobuccal, distobuccal, midbuccal, and all corresponding at the lingual sides. يعني mesiolingual, distolingual, and midlingual. We have a 6 points to record the bucket depth. بما إن ده الإندكس الوحيد اللي بيرفر to the treatment need، يبقى أنا عندي two codes. Code for the periodontal disease and code for the treatment need. For the periodontal disease, we have five codes. 0 is a healthy periodontal tissue. 1, there is a bleeding after gentle probing. 2, supragingival or subgingival calculus or defective margin. These reversible condition. 3, shallow bucket between 4 to 5 millimeter. 4, deep bucket more than 6 millimeters. ليه هنا بدأنا ب4 بداية الباكت؟ لأن احنا عارفين إن النورمال depth of the normal gingival crevices بيتراوح from 0 to 3. إذن up to 3 millimeter the normal depth of the gingival crevice and the bucket is starting from 4 millimeter. هنا تجيلنا حتة البلاك مارك اللي موجودة ما بين 3.5 و5.5. طب لو الباكت آخره 5 يبقى أنا لما أجي أدخل البروب هبقى شايفة البلاك مارك أقول على طول ده shallow bucket ودي سكور 3. لو البلاك مارك hidden داخلة تحت الفري جنجفا يبقى أكيد الباكت أكتر من 5.5 يعني 6 أو أكتر وبالتالي هقول عليها deep bucket. يبقى with this black mark that present on the CPITN probe, it facilitates easy interpretation of a shallow bucket and deep bucket. If the black mark is visible, it is a shallow bucket. If the black mark is invisible, it is a deep bucket. Criteria for the treatment need. Code 0 means this patient doesn't need any treatment need. It coincides with code 0, healthy periodontium. Treatment need 1, the patient requires oral hygiene instruction and motivation. This coincides with code 1 of the periodontal disease, the patient who has gingival inflammation. Code 2 requires professional scaling in addition to oral hygiene instruction. It lies with code 2 اللي هو قال إن أنا عندي defective margin عندي calculus. For sure أنا محتاج scaling and instruction for oral hygiene. 3 لو shallow pocket could be markedly improved after professional scaling and oral hygiene instruction. But if it is code 4 اللي عندنا فيه deep bucket, it require more complex surgical procedures or complex surgery, complex treatment, in addition to professional scaling and oral hygiene instruction. يبقى عندنا للperiodontal diseases 5 codes starting from 0 to 4. For the treatment needs, we have 4 codes starting from 0 to 3. Code 1, code 0, periodontal, 0 treatment. 1, 1 treatment. 2, 2 treatment. 3, 2 treatment also. 4 is a 3 treatment, which require complex treatment in addition to the professional scaling and oral hygiene and extraction. Again, 0, just bleeding, defective margin, shallow pocket where the black mark is visible, deep pocket where the black mark is hidden under the gingival. 0, treatment need 0, 0 code, 0 treatment need. Codes of periodontal 1 require treatment need 1. 2 require treatment need 2, professional scaling and oral hygiene instruction. 3, 2 also. 4, treatment need 3. No treatment, oral hygiene instruction, professional scaling and oral hygiene instruction, complex treatment in addition to the professional scaling and oral hygiene instruction. We have some of the assessment cases. يجيلنا ازاي؟ ممكن تجيلنا أسئلة شكلها ايه؟ ازاي اعمل application for this index؟ يجيلنا chart بهذا الشكل وتقول لنا identify this chart. This is the first question. The second, interpret this chart. For question 1, this is an index chart for recording CPITN index. Index chart for recording CPITN index. For the interpretation, here in the upper right quadrant, molar quadrant, we have at least one tooth with a deep pocket more than 6 mm, which require treatment need 3, which means complex surgical or complex treatment in addition to professional scaling and oral hygiene and instruction. For the left quadrant, molar, whether upper or lower, each one contain at least one tooth. لازم أقول contain at least one tooth لأن أنا I record the worst. فيبقى على الأقل عندي سنة واخدة هذا السكور. سكور 3, which mean this patient أو this tooth had a shallow pocket between 4 to 5 mm that requires treatment need 2, including professional scaling and root planing in addition to the oral hygiene instruction. All other remaining quadrants contain at least one tooth with a code 2, including defective margin, subgingival calculus, which requires the treatment need 2, professional scaling, and oral hygiene instruction. The upper right molar quadrant contains no functional teeth qualifying for recording. This diagonal line indicating that this quadrant doesn't have at least 2 functional teeth qualifying for recording. The anterior segment, whether upper or lower, have at least one tooth with score 1, means gingival inflammation or bleeding on probing, that require treatment need 1, oral hygiene instruction to improve this condition. The upper left molar quadrant contain at least one tooth with defective margin or subgingival calculus, which requires treatment need 2, professional scaling and oral hygiene instruction. Lower left, contain at least one tooth with a shallow pocket that require treatment need to professional scaling, planning, oral hygiene instruction. While the lower right molar area contain at least one tooth with a deep pocket more than 6 millimeters. It required treatment need 3, which includes complex treatment, professional scaling, oral hygiene instruction. When you find this without any diagonal line or without any number, it means that we have an edentulous maxilla. Edentulous maxilla. And this the same as we told before. This is some of the cases you have to assess yourself in recording this case. Another one. Thank you. I hope you are interested with my lecture.